Cancer treatment is complicated. It can be hard for patients or caregivers to find clinical trials online that are right for them.
What does this mean? This stuff might as well have been written by Martians.
What's the matter, son? I thought you were the online search master.
I thought so too, but it's not easy to find a trial or know what these words mean, much less if these trials are right for you.
Slow down. We are trying to find a clinical trial that might help my cancer. Why is it so hard?
Well, there are a lot of trials in a lot of cancer centers. They all seem to be very specific, and they have eligibility requirements. So it's complicated, very.
All right, print out what you found. Let's make a list of questions and we'll talk to the nurse at my next appointment.
When looking for a clinical trial, it helps to know as much about your cancer as possible, the type, stage, and previous treatments you've received. The best way to find a trial for you is to talk to your healthcare team. If you use the internet, take what you find with you.
We want to talk to you today about me joining a clinical trial.
We brought some stuff we found on the internet. Can you help us find a trial that is right for my dad?
I can help you. I understand how confusing it can be to look for a trial online. It's hard for doctors and nurses, even when we do this every day, to find trials and match them to our patients. But let's look at what you have, and I have some other options we can discuss.
Keep a file on all your medical records and ask lots of questions when you see your doctor or nurse practitioner.
So one thing I don't get, how do you decide who goes on what trial?
We think about a number of factors. What kind of cancer do you have? What stage? What treatments have you had? And how has your cancer responded?
So, you really have to know exactly what you're dealing with when you look up for a clinical trial?
That's right. It's one reason why we encourage people to get their medical records together and ask a lot of questions.
Your previous treatments and your overall health may influence whether you go on a trial.
I read online about eligibility requirements. What do they mean by that?
That usually refers to any treatments you have had and whether you are healthy enough to handle taking the drugs. Every trial has different requirements.
Some trials may be offered at other cancer centers, which can mean changing doctors or where you're treated.
That makes sense, but how do you find trials?
Lots of ways. We offer a number of them here in this center, but we also talk to our colleagues in other centers. Sometimes I look online too, or people like you bring me what they have found.
Oh, okay. That makes me feel better. We were having a hard time figuring out how to find a trial that might be right for my dad.
It's complicated.
Yes, but it's a very important part of what we do for our patients. You can always talk to me or your doctor when you have questions about your treatment options.
Once we find a trial that is right for me, how do I sign up for it?
The best way is to contact the trial team directly using the contact information on the website. Ask to talk to the trial coordinator. If you meet the requirements, the trial coordinator will set up an appointment to meet you.
Will somebody explain to us what will happen during the trial?
The trial coordinator will be able to explain what to expect during the trial and answer your questions. It is also the trial coordinator's job to decide whether you are likely to be eligible to join the trial. However, a final decision will probably not be made until you have met with a doctor who is part of the trial team. It is important to take notes and prepare questions for the trial team about what to expect if you decide to participate.
Ask questions. Communicating is key to getting good care, whether you're enrolling in a trial or not.
What happens once I decide to participate in a clinical trial?
Before starting, you will be asked by the trial team to give your informed consent. During this stage, the trial team will explain what will happen during the trial, and you will be asked to sign a document that says you understand the clinical trial and agree to be part of it. This is a good time to ask questions and a good opportunity to bring someone with you to the appointment to help fully understand what is being discussed.
What if I agree to participate but want to leave the study after I started?
You have the right to leave the study at any time and for any reason.
Thank you for all that information. It really helped us understand how a trial will work. I feel like we're a team working together.
You can take an active role in making decisions about your treatment. This is your life and your treatment.